My mom suffers from migraines, so it hit home when I could say, hey, you know, I'm in this avenue now full time. There's a lot of options now. You're not limited, and you can really not be in significant discomfort and make it more manageable for you. I work in neurology, specifically the headache specialty, so headache and facial pain. We see adult population that are kind of at their wits' end in a way, to think about it that way. They've tried maybe other avenues of care, or even just from their primary care, and those providers have kind of hit a wall, and so they get referred to us specifically for their headaches and management and things along those lines. We see patients that have had head injuries as well, that concussions, that end up having chronic headaches afterwards. We start out with trying to get their story, if there was an injury related to what kind of triggered their headaches or migraines, if it's something that they just grew up with from a small age, just getting that foundational work. What have you tried? What has failed? What has maybe worked? And what do we need to tweak? So it's just basically figuring out where they've started and how they've landed with us. We're not just looking at the fact that you have headaches. We're looking at what else you have going on: high blood pressure, diabetes, your cardiac status, your kidney function. Like, we have to look at all of that. We see them about every 3 months or sooner. So you get to know them, you get to know their family. We've had patients come in that their children end up having, like, it's a hereditary thing to have migraines sometimes. So you really get to know the patients, and you do have that piece that they'll ask you how your kids are doing or how things are going, and you just kind of bounce back and forth. So it's really nice. You don't really think, oh, a headache or a migraine, how debilitating it is, until you hear people's stories and they say, like, I've lost my job, I've lost opportunities, I've missed out on my kids' events in life because of how bad this has either been or gotten over the years. There's no cure for migraines or headaches, but we can at least make life manageable by managing symptoms and lifestyle changes. It's nice to just know that people are coming to you as the hope that you can really make them more functional again. When I'm not at the hospital, I have 2 dogs that take up a lot of my time. I've got a Great Dane, and there's a Doberman at home too. So a lot of just wearing them out, playing with them.